My name is Ashley Pollard, and in this video I will be documenting and discussing a type of dysomnia called hypersomnia, a disorder characterized by excessive sleepiness, prolonged sleeping, and daytime sleeping. Upon learning about hypersomnia, I immediately thought of my roommate Jamie. I've only been living with her for a few months, but it is obvious that she does not practice good sleep hygiene. I'm no doctor, but her sleep patterns remind me of those characterized in hypersomnia, and I use this video to exhibit the commonalities between the two. Jamie and I will reenact one scenario that exhibits her sleep patterns that have actually occurred this semester. Everything that you will see in this video is truthful as I try to accurately depict Jamie's story. Jamie has approved everything in this video.
Ashley?
What?
How late are you gonna be up?
Pretty late. I have a lot to do.
I just can't stay awake right now. I'm just trying to read this. If I were to go to sleep for 20 minutes, could you wake me up?
I'll try to wake you up, but I don't think you're going to wake up, Jamie.
Honestly, I have a lot of reading to get through. I have to type up my response. Like, I'm gonna get up. I have to get up. I'm just so tired. I just need like a 20-minute nap or something.
Alright, I'll wake you up. I'll try to wake you up.
Fine, thank you. Ashley? Ashley?
What?
What time is it? Did you wake me up?
I tried to.
What time is it? Ashley, it's 4:45. I have an 8:30. I didn't do any work.
As you saw, Jamie is not practicing good sleep hygiene. An example of this not depicted in the reenactment is when Jamie takes naps at midnight. Most times she does wake up, but obviously taking naps at midnight is not healthy for her body. During this semester, she has come close to missing class, missing meetings, or other important events because she did not wake up from a nap. She cannot go without taking a nap at least once a day. When I propose that she talk to a doctor about her sleep patterns, she gets irritable and tells me to drop the subject. As I said before, I cannot say whether or not Jamie has hypersomnia, and she very well might not, but her sleep patterns do worry me. Let's see what Jamie thinks about her sleep patterns. Jamie, how do you feel about being tired all the time?
I guess I'd say it's upsetting just because I feel like I can't, function to the fullest. I deal with it, though, as best as I can. I don't really know what to do. I feel like the only cure for sleepiness is to sleep, which I do a lot.
Would you say that it's it's interfering with your academics or your social life?
Absolutely. I mean, as far as my academics are concerned, I, have to study a lot. I'm a full-time student, and it's extremely difficult to study when I can never stay awake for things. Even if it's in the middle of the day at like noon, I really feel like I have to go back to my room to take a nap before I can go to the library. Because when I go to the library, I'll just sit there for 5 minutes with my eyes closed because I can't wake up long enough just to read, a sheet of paper. And then as far as my social life goes, of course it's a problem because I'm so tired. I can't hang out with my friends, in a normal capacity. If I'm going to go out to for dinner with people, I'm going to have to take a nap before, which I've done. And sometimes if I take a nap, I'll have to set an alarm. And if I sleep through the alarm, people are waiting on me, don't know where I am. It's rude and it's upsetting because it's not like I'm trying to miss events. I'm just so tired I can't wake up. And it's extremely problematic when I have nice events to go to or nice meetings to go to when I'm always late because I, woke up late. And it's a problem even when I get to the event because I'm so tired I feel like I can't talk to people because I just cannot stay awake for the life of me. If I sit down for 5 minutes at a party, I'll probably fall asleep. I've been in the back of cabs before and I fell asleep. I'm always sleeping and it is really inhibiting my social life. And I also feel like people don't understand why I'm so tired. or they must think I haven't slept for 5 days, but really I'm sleeping so much every single day. and I just don't know how to explain it to people.
Can you give or offer maybe a reason why you think that you're so tired even after you sleep for long periods of time?
Yeah, absolutely. So I know this is not, I'm aware that this is not normal and this is not healthy for people to be sleeping, 15 hours of the day. And what I think it is one, very basic. I'm under a lot of stress being, a Duke student. There's always a lot of work. And quite frankly, no student is ever just done with their work for the day. There's always something to be doing. So I'm always tired because I'm always trying to be on top of my game the best I can. And I work on top of being a student. And sometimes I'll take my work back home with me to get some stuff done ahead of schedule at my job so that I can just help alleviate some work during the day. So I have, my schoolwork, I have my actual work. I'm involved in a lot of extracurricular activities, and I, really enjoy being a part of them, and I like the people I work with, so I don't really want to give that up. But more importantly, I'm sure that this is very much tied to just mental health, because this semester I had a very difficult semester, and before this, I've recently had some deaths in my life, and I've been upset and depressed about it, and I'm always tired, and oftentimes when I am awake, I'll be thinking about upsetting things, so sleep is a really good way to kind of escape some of those thoughts. And there's really nothing I can do, I guess, other than talk to people about it, but for the time being, this is just the way things are.
Do you want this, your patterns to change, or is it just comforting right now to, sleep as often as you do?
I would really like to see these sleep patterns change, because I don't think it's healthy for anyone to go to sleep at 6 p.m. and wake up at 3:30 in the morning to do their homework before their class at 8:30. That doesn't seem like a lifestyle anyone would really want. But again, for the time being, it's working, and it is a problem, I recognize that, but it's just going to be a matter of time until this is fixed, and I'm just dealing with it as it comes.
Thank you, Jamie. It seems like Jamie's experiences might have made her especially vulnerable to distress in her life. Following the diathesis stress model, Jamie has maybe inherited certain tendencies that make her more vulnerable than others to develop certain dysfunctional behaviors. Now let's move back to discussing hypersomnia and what other things might contribute to developing this disorder. One of the most notable things Jamie said was that she is depressed and often thinks about the events in her life that have contributed to her depression. She then said that sleep is a way for her to temporarily escape those depressing thoughts, which is an example of negative reinforcement. Jamie's sleep is reinforced because she is avoiding those depressing thoughts. Hypersomnia is still being researched, and although it is difficult to say what exactly causes it, researchers believe that poor mental health, particularly depression, might be associated with it. In a 1972 study conducted by Detra et al., researchers concluded that hypersomnia is not an unusual symptom of depression. Consistent with this research, another study conducted in 1982 by Montplaisir et al. Found that dopamine levels are low in patients suffering from hypersomnia. Hypersomnia may also be associated with other psychological conditions as well as medical conditions, including metabolic and endocrine disorders. Sleep hygiene can influence hypersomnia and is important when evaluating the contributing factors of hypersomnia. If one practices poor sleep hygiene, like going to bed too early or too late, taking too many naps, not receiving enough sleep at night, etc., it could lead to dysfunctional sleeping. On the other hand, if one avoids these behaviors and tries to stick to a strict sleeping schedule, they are more likely to receive quality sleep that they enjoy. In regards to hypersomnia, poor sleep hygiene does not have to be present for someone to have hypersomnia, but healthy sleep hygiene may have some beneficial effects on eliminating the dysfunctional behaviors characterized in hypersomnia. Because hypersomnia is not a well-known sleep disorder, it is difficult to identify the best treatment option, especially because everybody's sleep patterns are so unique. Let's first look at diagnosing a patient. Doctors might evaluate biological, psychological, and social influences in the patient's life to determine what might be contributing to the disordered sleeping. Then they might perform multiple sleep latency tests or polysomnography tests to physically detect any disordered sleeping. If anything abnormal is found,
Doctors will then look at treatment options. A research study conducted in 1988 by Bastugi and Juve claims that modafinil, a type of wakefulness-promoting agent, is successful at treating hypersomnia. In this study, patients' sleepiness decreased by 60% and their number of sleep episodes per day decreased by 80%. The researchers also claim that little tolerance, dependence, or side effects came from using this drug, even after 3 years of use. Even still, less risky, helpful options are available. Keeping a sleep diary, regulating your sleep cycle, or limiting the number of naps taken per day can help reduce disordered sleeping. Even though hypersomnia is rare, there is hope in treating these patients. Sleep disorders are very unique, but according to the CDC, over 70 million Americans suffer from them. Those suffering from any one disorder should not feel alone in their fight against these disorders.